Hi everyone, welcome back to my channel, and in today's video we're going to be doing some learning on the news charts. I know you would have heard of the news chart before. That is the National Early Warning Score chart, and it's the advanced form of taking observations of patients. And I'll be giving you some demonstrations and some illustrations and the proper way of how to document. I know a lot of us know the, and some are not fully aware of how to fully document on a news chart. So in today's video I have different charts. I have the adults news charts and I have the children's news charts. Okay, now let's get. Yes, so on the news charts we have different sections. The first is the A and B, where we check for the airway and breathing, which is the respiration. Then the airway and breathing also we can check for the SpO2 scale 1. We have SpO2 scale 2. I'm going to explain the different scales of the SpO2. Then we have the air or oxygen. All these are under the A or B. Then we have the C, which is circulation. The C, we have blood pressure, where we check the blood pressure. And on the C also we have the pulse. Then D, that is where we check the level of consciousness of the patient. Then E, which is every other thing, you have the temperature, and this is where we check the total of what the news score is. Then there's a section where you escalation of care, yes or no, pain score, then you write the initials. Now the news keys, there are different forms of key. We have the 0, the 1, the 2, and the 3. Now this is the first column, where you put either put the patient sticker or you input the patient's detail in this column. You write if the patient is going to go to a ward or it's an exam, you write the ward the patient is going to go, then the dates. Now, so I'll be presenting 3 scenarios. We have the patient A, patient B, and patient C. Patient A has this vital signs and is on SpO2 scale 1. Patient is confused. Patient B, this is the vital signs of the patient, and the SpO2, patient is on SpO2 scale 2. See that the patient's news score, the total number of the news score will determine the appropriate escalation care you're supposed to take. Now, when a news score is 0, the frequency of monitoring is 12 hours. That means you monitor that type of patient every 12 hours. That means the patient is fine. There is no emergency care. The patient does not need anything urgent. And the clinical response you do in that case is continue routine news monitoring. That you just continue the routine. Now, when you have a total of 1 to 4, and the minimum frequency of monitor is 4 hours. You have to monitor this patient between 4 to 6 hours, every 4 to 6 hours. And the registered nurse must also assess the patient, and the registered nurse decides whether to increase the frequency of monitoring or escalation of care is required. Now, when you have 3 in single parameter, just know that you are going to monitor the patient every 1 hour. Any news score that you have a 3 in one single parameter, you have to escalate to the doctor immediately, and that is when the nurse escalates and calls the doctor. Now, when you have a total news score of 5 or more, urgent response threshold, that the minimum is also 1 hour. You have to monitor this patient every 1 hour, and you have to escalate appropriately. Now, when you have a total news score of 7 or more, The patient needs an emergency response, and you have to continue monitoring of vital signs. This type of patient might be consider transfer of the care to a level 2 or 3 clinical care facility, either a HDU or ICU. Then clinical care in an environment with monitoring facility. The type of patient has to be placed on a cardiac monitor to continually monitor the hemodynamic status of the patient. So just have this at the back of your mind that these are the total new score. Now we are going to be documenting this patient's A, vital signs, patient B, vital signs, and patient C, vital signs. Okay, now let's fill in the patient's biodata. Ward, I assume the patient is in ward A, B, and start dates today, that is the 13th of February 2020. Now, what is the name of the patient? Assume the patient's name is Ruth. The date of birth 10/10/1995. The hospital number 0000001. Make sure you fill the biodata of the patient. That is very important. But we've already assumed we'll be using patient A, B, and C. Now, the first column you make sure you fill is the date. It said today is what? 13. You already know that it is February. So what you just put is, we already know it is 2020. So you just put 13 to, most time just put 13. That is today 13 and the month of February. Now what is the time? To check the time, make sure you use your fob-watch always to check the time. The time is what? This is 12:50. So 12:50. Now, which said I'm going to be documenting patient's A vital signs first. Patient A's temperature is 38.4. After I did the temperature of this patient, what it gave me was 38.4. So I come over to the temperature column. So this is 38.1 to 39. So I document what? I just put a dot. 38.4. Now you can see this patient already scored what? A 1. Now respiration of patient A. Respiration of patient A is 20 cycles per minute. Coming to 20 cycles per minute. 20. Documented 20 here. Now this patient already has what? The new score of this patient for 20 is 0. Because don't forget, these are the key color coding. Anyone that is white is 0, yellow is 1, pink is 2, and slightly red is 3. So this patient has has a white color coding, that is 0. Now the pulse is what? 90 beats per minute. Pulse is 90 beats per minute. So 90. Assume this is 90. So 90 beats per minute, that is 0. Is on column 0. Then the blood pressure 110/70. Now in case of blood pressure, we only look at the systolic blood pressure. That in blood pressure, score uses systolic blood pressure only. You don't need to look at the diastolic blood pressure. And the patient's A blood pressure is 110. That is 110. Most time in blood pressure, you have to put an arrow down, 110/70. So you dotted line. Don't make sure it is not joined together. We just look at the systolic. We don't bother about the diastolic. Now, what is the systolic? It is 1. Now, patient's A is on SpO2 scale 1, 95%. Now, the difference between the SpO2 scale 1 and so if the patient is on air, that is 0, and oxygen, ask the oxygen, the liters of oxygen the patient is, automatically any patient that is on oxygen, the patient is going to have a score of 2. So patient is on 28 liters of oxygen. So the device also, you ask for the device. If it is a face mask or venturi mask or nasal specs, you have to impute it. If it's a nasal spec, you write NS. If it's face mask, FM. If it is venturi, VM. So this patient is on face mask, so putting it face mask. So that is the device of the oxygen to patient, the device in which the patient is going to take the oxygen. So you calculate, now we'll calculate the new score now. SpO2 scale 2. Most time SpO2 scale 1, patient oxygen saturation. SpO2 scale 2, oxygen saturation. Use scale 2 if target range of the oxygen is 88 to 92, or if the patient is hypercapnic, if the patient is in respiratory failure, or if the patient is having COPD, you mostly use SpO2 scale 2. And most time the doctor will tell you which target saturation the patient has, or the examine in situation of Osce exam, make sure you ask the examiner what is the target oxygen saturation of the patient. Now, patient A target oxygen saturation is 95% using the SpO2 scale 1. So now let's go 95%, charting 95% SpO2, that's patient as 1. Now, the patient is telling me here now that my patient is confused. I've already assessed the patient and I said that the patient is confused. So I have to come here to check for the consciousness level. That is under D. You can see alert is what? 0. For an alert patient, the new score is 0. But for a confused patient, it's 3. And already patient is already having more than 3 in that type of 3. Now patient is confused. Put in a dot. Okay, now we have to calculate the total new score. Let's see what patient A total new score is. The this is respiration is 0, so this is 0. This is 1 plus, okay, I did not put the pulse. The pulse is 90, so this is the pulse. So patient has a pulse. Pulse is 3. Pulse is 3. Respiration is 0. This is the saturation. Saturation is 1. Blood pressure. Blood pressure is 1. Confused. Patient that is confused, definitely the is already having more than 3 in one parameter, and the temperature is 1. So that is 1. So calculating the new score of this patient, 3 plus 1, that is 4. 4 plus 1, 5. 5 plus 3, 8. That's 1, 2, 3, 9. Now, coming to this now, you can see this patient has a total of 9. So you have to put it here as the new total is 9. Now it's comes here, it's going to ask you monitoring frequency. How often do you want to monitor this patient? Escalation of care, yes or no? Pain score initials. When you are doing your assessment, you should have asked for the pain score of the patient. A patient that has a new score of 9 or more, it says here that total 7 or more emergency response, and the frequency of monitoring should be continuous. So now you have to put monitoring frequency continuous. Escalation of care, definitely you're going to escalate the care of this patient. Pain score, we've assessed the patient and the patient say he has a pain score. Remember, the patient is confused. Patient gave us a pain score of 2, and at the end you write your initials. So that is our simple documentation of a news chart. So I hope you learned a little bit of how to document on a news chart. It's a very simple documentation, and just what you just need to know is to know the difference between the SpO2 scale 1 and the SpO2 scale 2, and make sure you know how to calculate the new score, and you should also know the frequency of monitoring of a new score. So those are the things that will help you. And when you are doing, if you have any news charts in your Osce examination, or when you're practicing on the word, make sure you know the adequate escalation plan you're supposed to do according to your hospital policy, according to your trust policy. Make sure you escalate appropriately. That is going to help you in how to also hand over the patient using the SBAR. So these are the tips you need to know. Make sure you escalate appropriately, know the scale the patient is on, and make sure you continue monitoring the patient according to the frequency stated on the National Early Warning Score. Thanks for watching this video, and watch out for more teaching tips on this channel. Hope you enjoyed this video on the news chat. I'll see you in my next video. Thank you.